Hi, welcome to this edition of Health Feed. I'm Katie Wick, your host, and today we have Dr. Jennifer Tinguely with us from the City of Sioux Falls Health Department and Falls Community Health. We're going to talk about a disease that we have is now kind of a resurgence for us here.
Yes.
We didn't hear about this for a really long time, and a lot of people don't even know what measles looks like or how it acts, but we're going to talk a little bit about measles today because we're seeing some of that around the country.
Yes.
And in South Dakota as well.
Yep, we are.
So talk to us a little bit about that.
Yep. Yes, so measles, it's a virus. I mean, it's spread in the air. So somebody coughing, runny nose, so it's an airborne, respiratory droplets, very, very contagious virus. It has a number of different symptoms, and I think the one people think the most about is just a rash. So there's kind of a classic rash that's associated with measles. But it presents in different ways early on in the illness, but that's what it is. It's a very, very contagious virus. And like you said, we had not seen it for decades. I mean, this was not something I learned about in medical school. I learned about it, but we just knew we wouldn't see it. And yes, over the last few years, we are unfortunately starting to see it.
Okay, and why is that? Where are we getting this resurgence from if we've not seen it for so long?
Right, so there's a vaccine. It's the MMR vaccine, incredibly effective at keeping this virus away. People will not catch it if you're vaccinated. What's been happening over the last, I would say 5-6 years, especially post-COVID, we started to see a lot of hesitation about vaccines. We've seen a drop in our vaccine rates, particularly of this MMR vaccine. And so now we're starting to see cases pop up.
So the MMR vaccine helps protect us against measles, but what does MMR stand for?
Yes, so it protects against measles, mumps, and rubella. So we commonly think of those as like childhood vaccine or illnesses. So that, we tend to not see these a lot in adults. And what we're seeing right now in the measles outbreaks across the country is these very much are affecting younger people. Again, most adults have actually been vaccinated. It was just a routine vaccine. We had to get it before you go into kindergarten, and we just didn't really have to deal with it. But here we are.
So most of the folks who are getting measles are probably unvaccinated for the most part?
Yeah, I think it's something like 93% of all of those folks that are getting confirmed cases of measles are unvaccinated.
So if someone gets the measles vaccine, and talk to us a little bit about that, is it one vaccine? Is it two?
It's a 2-vaccine series. So the first one is given when a little one is 12 to 15 months old, so right around that 1-year age. And then they'll get a second booster to go into kindergarten. And here in Sioux Falls, for example, it is a required school vaccine. So you would have to apply for an exemption to not have your kiddo vaccinated before they head off to kindergarten.
Okay. And so if somebody gets both doses of that vaccine at the appropriate age, how effective is that vaccine?
Incredibly effective. I mean, we're close to 100%. Nothing's 100%, of course. Obviously, there are still some people that have been vaccinated that are being confirmed with measles. So it can happen, but it is very, very good.
Okay. And the safety of the MMR vaccine, we've had it for a long time?
Yes, I think we've had this vaccine since the 50s. There has not been any, known adverse effects from being vaccinated with this particular vaccine. Incredibly safe, as are all vaccines that have been approved by the FDA. If your doctor is recommending a vaccine, it is because it has been studied, trialed. We know that it is safe.
Okay. So if somebody doesn't get the vaccine by the time they're 5 or whatever, at school for whatever reason they haven't gotten it, is it still safe to get it later?
Yes, absolutely. So it's never too late to get a vaccine. And we actually say for adults too, again, these outbreaks we're seeing it more in younger people, but if you're an older adult, perhaps born before 1957, the recommendation is to get a vaccine, just one dose. Also, if we're not sure if somebody had been vaccinated, if they were born in the 60s, 70s, but maybe they don't have proof of immunity, we can still get that vaccine for them. And I would highly recommend it if there is an outbreak in your community because it is such a contagious virus.
So you talked a little bit about people who it's not 100%. So if somebody was immunocompromised or something and they were exposed to measles, would they still have some protection then?
Yeah, this is called herd immunity. And so this is really important because there are people that cannot be vaccinated. If they do have an immunocompromised state, maybe they're being treated for cancer, a little kiddo who's being treated for cancer, and they cannot get vaccines just in order to keep them healthy in that regard. What we count on then is that anybody around them is vaccinated. So that virus cannot spread in that community if we have what's called herd immunity. And for this particular illness, we want 95% of the community to be vaccinated. If 95% of the community is vaccinated, that basically keeps 100% of the people safe.
Yeah, because there's some people who cannot get vaccinated.
Absolutely, yeah. There are some conditions that people have that they cannot have vaccines. And yeah, that's the unfortunate. So all of our responsibility to take care of one another, but if you can, then you take care of yourself too by being vaccinated.
Absolutely. So talk to us a little bit about what it looks like possibly to get measles.
Yep.
Like what somebody would see if their child or even an adult would start to get ill.
Yeah, so as with most viruses, what we tend to see are fevers. Now, measles can have really high fevers. I mean, up to 104, 105 degrees. And then there's what we call the 3 C's, and the C's stand for cough, conjunctivitis, which is kind of pink, inflamed eyes, and then coryza, which is runny nose. So cough, pink eyes, runny nose, and high fevers. Those are kind of the beginning symptoms. After a couple of days, then we start to see the rash and the spots. So it's hard this time of year. You know, we've got influenza, which can present with very similar symptoms, the fevers, the cough. Just your common cold can present that way too. So this is why it's a little confusing when somebody comes in sick. I mean, what do they have? If they've been vaccinated against measles, we wouldn't probably think that they have measles, but it is now in that differential diagnosis.
Okay. So what can the community do as a whole? If there's anything that community members can do to help either educate or make sure people are vaccinated, or what can we all do?
Right. I mean, obviously the best thing is just to be vaccinated, but I think the one important thing, especially in this day and age, is to not spread misinformation. So I think people are starting to get what they think might be valid health information on TikTok, YouTube, just places that's probably not where we should be getting our health-based evidence from. I think talking to a healthcare provider that you trust, going to websites that are legitimate health resources. So the CDC website, the World Health Organization website. There are some big hospital systems, University of Chicago, of Massachusetts, Harvard. I mean, there are good places to get health resource. I do not think social media sites are the right place. So as a community, I think not spreading information that we're seeing on social media sites because it might not be accurate. And I just think that's a real risk to everybody.
Yeah. So we want to get the right information out there for everybody so they understand how come we're seeing some of these things that many of us have never seen or thought was maybe gone.
Yeah. I mean, this is exactly right. We never really thought that we were going to have a resurgence of measles, and we're seeing it in South Dakota. We had 0 cases in 2024. We had in the teens number of cases in 2025. So we weren't 0 anymore. And already this year, it's only February, we've had 6 cases of measles in South Dakota. Again, all unvaccinated.
Yes.
So,
and with how people travel anymore.
Yes.
And it's very quick to get from one country to another in one day on a plane full of people, where this is something particular that could be
and there's parts of the world where they do not have the vaccination rates that we have typically had here in the U.S. So there are parts of the world where measles is actually quite common, and again, because it is so contagious, and if you're not vaccinated, the likelihood of you picking up measles is close to 90%. I mean, if you're exposed to it and you don't have that vaccine on board, chances are you're going to get measles, and then that's where it just snowballs and we start spreading it. Yeah.
And especially to those vulnerable populations of people who are unable to be vaccinated because it's a live virus that you get to help protect.
Yes, to help protect you. Yeah, that's the thing.
I
mean, I think we just have to think about those that absolutely can't get vaccinated.
Well, we very much appreciate your time and giving us the facts and the accurate information to get out there for everybody to understand.
Thank you for having me.
Thank you. Thank you for joining us today. And if you have any further questions, please contact your healthcare provider or contact us at Falls Community Health.